Cutting carbohydrates is not the fastest way to fix your blood sugar. Adding the right vegetables is. And most seniors managing diabetes or prediabetes have never been told this because a 12-minute clinic appointment does not leave room for it. Here is what is actually happening inside your body. High blood sugar is almost never the root problem. It is the symptom of something upstream called insulin resistance. Insulin is the hormone that unlocks your cells so glucose can leave your bloodstream and enter the cell where it belongs. When insulin resistance develops, your cells stop answering. And the standard response is another prescription pushing more insulin into a system already drowning in it. The vegetables I'm about to share do not work by starving your body of carbohydrates. They work by doing one of three things: slowing how fast sugar enters your blood, cooling the inflammation that keeps your cells deaf to insulin, or waking the insulin receptor back up so your own body does the job it was designed to do. My name is Dr. Williams James. I have practiced geriatric and metabolic medicine for 25 years. I have watched patients bring fasting numbers down within days using these exact vegetables without touching their prescriptions. Here is what works. The first vegetable is broccoli sprouts, not mature broccoli. The tiny 3-day-old sprouts contain up to 100 times more of an active compound called sulforaphane than a full-grown head. Sulforaphane does something remarkable. It travels directly to your liver and quiets the overnight glucose factory. Your liver produces sugar while you sleep. In insulin resistance, it produces far too much, which is why so many seniors wake up with a high fasting number despite not eating a single thing overnight. A 2017 study from Lund University found that concentrated sulforaphane measurably reduced fasting blood sugar, with the strongest results in the people whose numbers were hardest to control. A small handful raw on a salad or sandwich most days is enough. Do not cook them hard. Heat destroys the active compound entirely. The second vegetable is bitter melon. This one surprises people. Bitter melon contains compounds that behave almost identically to insulin itself, binding directly to the same cellular receptors. Research published in the Journal of Ethnopharmacology found meaningful reductions in fasting blood sugar in adults with type 2 diabetes who consumed bitter melon regularly. You can find it in most Asian grocery stores or as a supplement. Lightly stir-fried with garlic keeps the active compounds intact while making it genuinely edible. The third is spinach. Dark leafy greens are dense in magnesium, a mineral that plays a direct role in how insulin receptors function. Research shows that adults with the lowest magnesium levels have the highest rates of insulin resistance. Most seniors eating a standard diet are chronically deficient. A large handful of spinach daily, cooked or raw, begins restoring that deficit within weeks. Add it to eggs in the morning and you have combined two of the most powerful blood sugar tools into one meal. Now here is where most people stop reading, and that is exactly the mistake. The fourth vegetable is okra. Okra contains a thick soluble fiber called mucilage. When it moves through your digestive system, it forms a gel that physically slows how fast carbohydrates are absorbed into your blood. No flood of glucose means no panic response from your pancreas. Roasted okra or okra soaked in water overnight, then consumed before meals is a practice used in traditional medicine for generations and now supported by published research showing meaningful reductions in post-meal glucose spikes. The fifth is Brussels sprouts. Like broccoli sprouts, they contain sulforaphane, but they also deliver a significant dose of alpha-lipoic acid, an antioxidant that research from multiple clinical trials links directly to improved insulin sensitivity and reduced nerve damage in diabetic patients. Start with one vegetable this week, add another the following week, stack them gradually. Your cells did not become resistant overnight, and they will not recover overnight. But give them the right signal consistently, and they will start answering the door again. Everything shared here is general medical information based on published research and clinical experience. It is not personal medical advice. Always consult your physician before changing your diet or medications.